Are you looking for an experienced clinician with over 31 years of clinical experience? One with a proven record of helping complex medical problems? One who's regularly referred patients by GPs and medical specialists for difficult problems because he's known for thinking outside the box and who practices an integrated approach to medicine? If your answer is yes, then please continue to listen. My name is Jerry Gajada Singh, and I founded The Health Equation based in London's Medical District back in 2004. Patients tend to be treatment orientated. When they develop symptoms, they tend to choose a treatment that they think can help or has been suggested by a healthcare practitioner. Sometimes the treatment works, sometimes it doesn't. The common theme with many of my patients is that they have complicated problems. They have often tried multiple types of treatment with minimal or only short-term benefit. That's often because the issue is an unclear diagnosis. By that I mean what is actually wrong with the patient is unclear. Sometimes working out what's wrong with the patient takes time, and more often than not, lateral thinking. Asking the right questions during the history, an appropriate clinical examination, and sometimes additional investigations such as imaging and blood tests with the right interpretation can come up with a more accurate answer, leading to a more targeted and therefore effective treatment. New patients to the health equation or returning patients with new problems are offered a diagnostic consultation which lasts up to 60 minutes and will determine their clinical needs and propose treatment to help them get better. It's important to know, in the normal, conventional medical paradigm, when a patient develops a symptom or a series of symptoms, doctors and patients are usually looking for a label, a diagnosis. What is the name of the condition in order to decide what may be the correct treatment? Whilst this may work for some defined medical problems, there is a large percentage of patients where their problems or symptoms are much more complex and often functional. By that I mean one or more of their internal health systems are not working optimally. I have over 31 years of clinical experience, and my job is to make sure there is no obvious pathology, where medical referral may be more appropriate, and then to explore the functional components that may be contributing towards the patient's particular problem. The three main areas of functional disturbance are, number one is structure. This is generally the neuromusculoskeletal and visceral function. Viscera are the internal body organs. Number two, biochemical. This generally involves hormones, nutrition and breathing. And number three is psychology, including conscious and subconscious patterns or behavior. I see a large number of these complex patients, usually referred by GPs and consultants. It's not unusual for the patient to want to know in advance of the consultation, can I actually help them? Our standard response to the health equation is to say, it depends. Whilst I'm sure this may be frustrating for some of these patients, it's an honest answer based on my 31 years of clinical experience in dealing with complex clinical problems. Until the patient attends for a diagnostic consultation, it's often impossible to know if I can help or not, until I can be more accurate in understanding the nature of their problems. Patients are individuals, they are not conditions. Diagnosis is a very individual thing, and an accurate diagnosis, not just the medical label, is critical to try to develop more targeted and therefore successful treatment interventions. It's what I call a holistic, integrated approach to medicine. It may be helpful to share some of the responses that I've received from patients after their diagnostic consultation. You've asked me questions no one has asked me before. You have allowed me to understand the information that I thought was irrelevant can often be very relevant to my current symptoms. You have allowed me to connect the dots and understand that many of my symptoms may well be connected. You've gone into a very detailed chronology, both of how my symptoms started and my past medical history. Actually, the reason for doing this is there's usually a reason why someone has a problem. For me, the diagnosis is as much why now, and what the problem actually is. This leads to a much more detailed understanding and therefore targeted treatment intervention, which, in the vast majority of patients, proves more successful than any clinical intervention they've had before. We also have a saying at the Health Equation: everything is about something else. You've explained how my body and my mind works together. You've explained how my behavior, such as my breathing behavior, if it's not working properly, can impact on my symptoms. You have explained how my lifestyle, in particular the things I eat and drink, can either support or hinder my metabolism, and therefore contribute or sometimes cause my problems. You've helped me understand the difference between diagnosis of pathology, which is actual disease process, and functional disturbance, where systems in my body are simply not working properly. This has helped me understand why other clinicians have told me that they can't find anything medically wrong with me. You've helped me understand how a functional interpretation of blood tests can give me a better insight into my problems and help to develop the pathways of improvement. So what happens during a diagnostic consultation? Well, I take a full case history review of your past and current symptoms. I explore your and your family's medical history, social history, and contributing lifestyle factors. I provide an appropriate clinical examination and, if necessary, request relevant diagnostic tests, such as blood tests, x-rays, and scans. One of the unique diagnostic and treatment tools used at the Health Equation is non-invasive capnometry and heart rate variability monitoring. Performed if clinically indicated, this specialized piece of equipment measures end-tidal CO2 levels, breathing rate, heart rate, and heart rate variability, and is one of the most scientific methods of diagnosing breathing pattern disorder. It also explores an individual's autonomic nervous system response. The autonomic nervous system controls many of the systems in the body automatically. I then compile a differential diagnostic shortlist of the possible factors behind your complaint. Sometimes there are quite a few. The key to a lot of this is the interpretation of the information that I've gained. A good example is the interpretation of blood test results. Medical reference ranges used when interpreting blood test results are based on a statistical term called the normal distribution, where 95% of the results are in the range. What this actually means in practice is that the vast majority of patients are told that their blood tests are normal. Whilst that's probably correct from a pathological or a disease perspective, it gives no insight to the functional changes that may be relevant to that patient. Therefore, at the Health Equation, we use different, narrower reference ranges based on more recent research. It can help us manage patients differently, again giving more targeted treatment interventions. With diagnosis, patients tend to fall into two categories. They're either simple or discrete clinical problems, or they're complex clinical problems. For simple clinical problems, you'll be offered follow-up treatment with either myself or one of my clinical team, depending on the nature of your problem. For complex clinical problems, you'll be offered a variety of treatment pathways, which may include treatment at the Health Equation or outside with other clinicians. We of course take into account your preferences, your budget, and level of care that you will need to help you overcome your problem. The treatment that we offer at the Health Equation may include osteopathic manual treatment, breathing re-education and stress management techniques, nutrition, in particular the Metabolic Balance Nutritional Program, and medical acupuncture. I'm also happy to refer you and liaise with affiliated colleagues for exercise and rehabilitation, Pilates, or other forms of exercise. Sometimes it becomes apparent during the case history or clinical examination that the cause of the patient's problem may well be pathological as opposed to functional, where conventional medical intervention may be more appropriate. This may be confirmed by diagnostic imaging or laboratory testing arranged at your diagnostic consultation. In such cases, I will liaise, with your consent of course, with your GP, private or NHS, or refer you to an appropriate medical specialist for further opinion or specialist investigation. Having worked in London's medical district for over 31 years, I've built up a formidable list of medical contacts who are recognised as leaders in their respective fields of medicine. Thanks for listening. This has been Jerry Gajada Singh at The Health Equation.